Now, this is the... All
Yeah,
right.
this was a little bit challenging, but let me give you my thoughts how I worked on it.
All right,
So
no
the
problem.
nurse is caring for assigned clients. So we have these 4 clients that the nurse is taking care of. It will be most important for the nurse to monitor. So the one um, result that the nurse will see, the one that's abnormal, I'll put it as an abnormal. That's the most important thing for the nurse to monitor. So number one, it says serum lipase levels for the client with hypercholesterol. So we know this is the lipase, the blood type we are testing for. So already the person has hyper, it's high. So that one I took it off for me. And then I said arterial blood gas results for the client who has an acid base imbalance. So this person already, the results are out, but he has acid base imbalance. It could be the pH, it could be the POA, well, carbonate. So I chose that, make sure exactly where the problem is. And then I went to 3 serum glucose level for the client with diabetes insipidus. Okay, we know that's the blood type for the person with that, but it didn't say exactly what the problem. It just stated diabetic insipidus. It didn't give a problem. And then I went to 4 adrenotropic hormone levels for the client who has a fluid imbalance. I actually didn't know the SCTH, but I said to myself, fluid imbalance doesn't comes with this, so I just eliminated it and I was left with 2. But I struggled, I won't lie.
Okay. Right. Let me explain something related to the question. I understand you did great, right? Which is your answer is definitely right. 100%. Your answer is correct, right? So far so good. Your first question you got it correctly. Second question you got it correctly. Your third question, which is this, definitely you got it perfectly. Fine. But now let me explain something. The key thing that NCLEX is trying to test here is what we call monitor. Now,
Mhm.
because we have the client, right? This is client one, client two, client three, client four. So we are trying to monitor. So you need to understand, what are we monitoring for? Now, for number one, you are trying to monitor a client. Look at what they are saying. They say the clients have what? Hypercholesterol. Well, we are trying to monitor what? Their serum lipase level. Now, another client have what? Acid-base imbalance. We are trying to monitor their ABG result. Another client have what? Diabetes insipidus. We are trying to monitor what? Their glucose level. Another client have fluid imbalance. We are trying to monitor their ACTH level, right? So now the question is not putting a particular keyword. They said most important. Now, this keyword is trying to tell you this is important to monitor, this is important to monitor, this is important to monitor, this is important to monitor. But the bullet part, which stated what? Most means that there's only one that is most important right now out of the 4 clients we have. So now, most important will be related to the patient condition. One patient is having high cholesterol, another patient is having acid-base imbalance, another patient is having diabetes, another patient is having fluid imbalance. Now, who are you going to prioritize, right? It's based
Oh,
on who will likely die first. Are we making sense? Because you are trying to
yes.
monitor something related to the patient condition, but you need to know the patient's condition before you know what you are going to monitor. Because you don't just monitor without the condition. It's just like now, if you are trying to monitor a patient, you need to know the situation first. Is it that they came back from a procedure? Is it that they just got a specific treatment? Did they just add a medication? Are we monitoring related to their condition? You need to know what you're monitoring for. In this case, it's related to patient condition. Patient one have what? Hypercholesterol. Patient two have what? Acid-base imbalance. Patient three have what? Diabetes insipidus. Patient four have what? Fluid imbalance. Now, if you are trying to think about who is going to die, right, it's always come in level. I gave it in prioritization, right? Level 1, we
Yeah.
have the CNR. Level 2, we have your GI, endocrine, your renal
Mhm.
system, your immune. Level 3, you have your reproductive system, you have your musculoskeletal, right? And then you have your integumentary, which is the skin. Right. So now, if I'm to monitor patient condition, I will try to group condition related to what the CNR first. I will look at it. Hypercholesterol, right, is something related to what? It can be something that can affect what the cardiovascular, So I'm like going to put what cardiovascular right there. This is related to respiratory. Diabetes insipidus is related to endocrine. You can see endocrine is level 2. So these two will be my first thinking first before even number 3. I'm going to like X number 3, except if number 3 is experiencing something that put number 2 and number 1 less priority. But guess what? Right now, it's just diabetes insipidus. Nothing has been said about the patient. So I cannot really prioritize based on that because nothing has been said about the patient. It's not life threatening. So number 3 is definitely going to be out. Fluid imbalance, right, can affect what the if you have fluid imbalance, I don't know what kind of fluid imbalance it might be. Maybe the patient fluid is overload or what, maybe less, overload can be a problem, less can also be a problem related to like these 3 big body systems. So I'm also going to like put it as something that might be parity, because fluid imbalance can either affect your cardiovascular, but let's not just say cardiovascular circulation. It can affect what circulation, electoral. There are a lot of things that it can affect. So it can affect cardiovascular, neuro, right? So yes, let's just put cardiovascular neuro right here because fluid imbalance is a lot of a thing, right? So we have these 3 things right here. So we have hypercholesterol, we have fluid imbalance, and we have acid-base balance, right? Now, acid-base balance, hypercholesterol. Before hypercholesterol can be a problem, it need to have caused something related to what CAD, right? Which maybe can cause maybe blockage, right? And situation like maybe it has started causing maybe angina or causing maybe MI. That is when it's a problem. Hypercholesterol is still the like medium part of the patient. If I'm really putting it right, like it's mild, right? In as much it's not yet causing all this problem yet, it's not severe, right? That's the main reason why we are trying to like monitor the serum lipase level to make sure that okay, it's not maybe in a stage that oh it's dangerously high, or maybe it can easily cause what MI, something like that, so that patient can easily wait. Right now, the fluid imbalance patient as well too, the question is not indicating the kind of fluid imbalance they have. They just says fluid imbalance, and also these patients having fluid imbalance, they are not really having something that is life threatening. It's just fluid imbalance. So right now this patient is still safe as well too. So number 1, number 4, they are definitely safe. There's nothing you can say about acid base imbalance. If acid base is not balanced, it's a problem. There's nothing you can, there's no how you can justify that patient to be safe when the patient have acid base imbalance. It's a problem. It's a problem. So the only problem we have right here is definitely true, because that can be related to what metabolism. It can also be related to what respiratory. And guess what? The biggest aspect that can be affected is the respiratory. And when respiratory is affected, what will happen? Patient can die. So that's the reason why the most important thing, despite the fact everything are important, the most important thing to monitor right here is the atrial blood gas. That's the most important thing, because that's what help the body the most out of everything that is right here. Number 3 is just a condition, a chronic condition. A patient can wait. Fluid imbalance here might be acute situation. Hypercholesterol here can be a chronic condition as well too, right? But the only 2 situation right here might just be 2 and 4 that might be that important. But the most important right here is your acid-base balance, right? Your acid-base balance. So yes, that's the most important thing. You definitely to me, if I would pick the next most important one, I would say 1. After acid-base balance, I would say 1, because if you have high cholesterol, the patient can be at risk for MI. Right. So that will be the next one. Right. So the next one after that, I'll pick 4, fluid imbalance. Right. And the last one I'm going to pick 3. 3 is the least, because yeah, what do you expect from patient like that? Pass urine, pass urine. You just encourage them to like um take fluid and use their medication, right? That reduce the amount of urine they are passing. So 3 is the least right here. Fluid imbalance is not good at all. Right, but at the end of the day, you cannot like prioritize fluid imbalance over hypercholesterol. right? So acid-base balance first, hypercholesterol second, fluid imbalance third, and lastly, diabetes insipidus. Any question?
So far, no question.
All right, great. So anytime you see monitoring, you are monitoring related to something. So you need to find out what are we monitoring and what is the
Okay.
NCLEX testing related to what you are monitoring. Some certain question will test you to monitor for something that you need to follow up immediately. Right. And let me tell you the truth. When NCLEX is telling you to monitor, they use keyword like immediate intervention, immediate action, um, right, immediate follow-up, life-threatening syndrome, life-threatening situation. All these keywords scream this principle right here. You will have to look for something that is really affecting the CNR first. Then easily you can navigate the question. I will show you a particular question now so that you understand what I'm saying. There are all these questions I'm going to show you right now. I'm just going to be scanning through this question. Um they are all related to monitoring. The question I will show you will be related to monitoring something. Right. Now, this is one that's related to monitoring. I want you to answer this question.
Okay. The nurse in the emergency in the ER is assessing a client with multiple injuries that occurred as a result of a motor vehicle collision. So that's the body. Someone brought to the ER with multiple injuries from the vehicle collision. Which of the following findings should receive highest priority? This is the same thing that, as you mentioned, to monitor the ones that you see that the conditions are worst, right?
Yeah.
That falls under those level 1, 2, and 3. So 1, avulsion injury of the left index finger. So that's a finger, which it's not about cardio, it's not about respiration. So we'll put it aside. And then deep laceration on the right forearm with blood oozing from the surface. So we have a circulation thing here. So I'll put it a question mark. Hematoma on the left side of the neck. And then open fracture of the right tibia and fibula. So I will eliminate 1 since we have circulation issue on 2, and then we have a hematoma on the left side of the neck, and then open fracture of the right tibia and fibula. This open fracture, I'm a little bit confused because it didn't say exactly what the problem is. So I will just go with 2, deep laceration on the right forearm with blood oozing from the surface.
All right. Now, when you are trying to read into patient condition. Let me teach you something. When you are trying to read into patient condition, you are trying to read into patient sign and symptom. You are trying to read into patient maybe results. You are trying to think about one thing. Everything you are reading through must all link to one thing, which is this patient going to what? Die now or maybe soon?
Oh.
That is what you are trying to read. It's not about what the patient is experiencing, it's about the result of what the patient is experiencing. Because the whole goal of nursing is to make sure that the patient is either totally stable or somehow stable, and we feel like yes, they have much time, even if they are going to go through this condition for long, but they are not going to die. Right. So now when the keyword is talking about highest priority, means that there's something that if you don't attend to right now, out of every of these, right, injury, because the question is talking about what? Multiple injury. So this is the patient injury 1, injury 2, injury 3, injury 4. Am I making sense?
Yeah.
So that's the patient injury. So now the reason why the NCLEX is not saying we should do something that is related to high priority is that one of these injury can lead to death. Now, that is the reason we are going through those injury to find out which of them can lead to death if we don't prioritize it immediately. Now, this one is talking about injury to the finger. Finger cannot kill the patient. Am
Yeah.
I making sense? Right.
Yes.
Now, this one to open fracture. Open fracture cannot kill the patient. Fracture don't hold life. So fracture cannot kill the patient. So these two kind of injury cannot kill this patient. Now, this injury is related to bleeding. This injury as well is related to bleeding as well. They are both bleeding because this is hematoma. Hematoma is bleeding under the skin, blood oozing from surface. Obviously, you can see it coming out from the surface. Now, when we are trying to prioritize bleeding, I wanted to teach this, right? But it's a lot, so
Mhm.
I'm still trying to figure out how to teach it. Now, when you are trying to prioritize bleeding, we prioritize
Mhm.
bleeding to what is causing that bleeding, right? Is it
Mhm.
trauma that is causing the bleeding? Is it is the bleeding? We are also trying to find out, is it related to trauma? Is it related to a specific location, right? Trauma, location, and is it a bleeding that is what? An active what? Bleeding. Or how much is the bleeding? Let us say how much is the bleeding, right?
Mhm.
Now, when the question is talking about bleeding, you will notice that it's giving location. So the question is testing you bleeding related to location. So this one is saying
Mhm.
bleeding from surface, right? Right?
Mhm.
Now, deep laceration on the right one with blood oozing from the surface. This one is talking about bleeding under the skin related to the neck. Now, the location is what? Forearm, the location is neck. Anytime NCLEX is testing you bleeding related to location, the location will tell you if it is priority. The two main location that you can really prioritize the most is what? The head, the neck. Because this
Mhm.
is where you have your airway structure, right? Like now,
Mhm.
if a patient return from a particular surgery related to removing of the thyroid, and then you said, and one of the answer key is telling you patient is constantly swallowing. What are you thinking? Why is patient constantly swallowing? It means that they are bleeding. They are like swallowing their own blood. So it's a
Yeah.
priority. We don't know whether the patient is swallowing blood, but the fact that the question says patient is constantly swallowing, you can observe the patient constantly swallowing, just select the answer, it's a priority. Right. Because now we say the patient is constantly swallowing related to a surgery, right? That we have to go through the oral route for that surgery. It's a priority. So now the question is saying a patient is having bleeding related to the neck. That is airway. So neck bleeding and forearm bleeding, which one are you going to prioritize?
Neck, of course.
Obviously.
Yeah.
So you can see how we answered the question. The question was not
Yeah.
related to what the patient is experiencing, but how threatening those situation can be.
Yeah.
You understand? Because if you think to what the patient is experiencing, you will say, oh, deep laceration to the forearm, that might be so deep. Then you start adding emotion to it. But nurses don't
Mhm.
prioritize using emotion. Nurses prioritize using what the patient will experience. The result of what the patient we experience. If blood keep pulling under the skin related to the neck, guess what? It will tighten the airway and the patient will start having difficulty to breathe. So the highest priority is to save the patient. If a patient is bleeding from their forearm and the patient is having bleeding from the neck, I'm going to immediately save that patient that is having bleeding from the neck because the forearm cannot kill the patient now. But the neck, if there's no explanation you can explain, and you are saying, "Oh, but I thought the patient was bleeding so bad from the forearm. That's the reason why I decided to go for that." But the patient is bleeding from the neck. You say, "But don't you realize that the neck contain a particular structure that can keep the patient better alive than the forearm?
Mhm.
The forearm don't hold life, but the neck can hold your life because those are the things that keep. For a patient to die, I always used to say this: for a patient to die, the cardiovascular system must be affected, the neurological system must be affected, the
Mhm.
respiratory system must be affected. For a patient to die, every other body system, we have 10 body system, right? Every
Yeah.
other 7 body system need to affect these 3 body system for a patient to die. Am I making sense?
Yeah.
All right, great. You understand?
Yes. Yes, I did.
All right.